Thank you so much for the kind words and also the opportunity. And I'm very happy to see so many people interested in actually making it to the event. I have met quite a few of you in the break, both colleagues and those affected. But let's face it, it's a hard job to speak to such varied audience, including professionals and those affected, family members, etc. But one thing is we share is we are in one way or another involved in caring for these people. So when I got the invitation to say a few words about Hungarian experience, I'm not going to focus on experience with specific medication, but I would like to give you a general overview of how I see the care offered for neuromuscular diseases, people with such diseases, and how you can pass it on. Okay, in an ideal case, when you want to provide ideal care, you need to know what your objective is. Obviously, it's the quality of life, providing as good quality of life for those affected and of their families as well. Life expectancy, functionality, but psychosocial well-being is also part of caring for these people and their families. Now, how you can hit these objectives, you need a number of things. Caring for these people is difficult because it affects more than one organ, more than one part of the body, and you need to involve professionals from a number of areas to achieve these targets. So first of all, you need to have professionals who have an understanding, an underlying knowledge of this condition, are motivated and are committed. And also, you need cooperation. Once you have the professionals available, you need cooperation. We need to have an agreement and it's important not to have not only cooperation and communication between professionals, but also between professionals and family members. That these professionals keep sending the same message to the families. As you can see, you have a great number of professionals these people need to see. And it's very important to make this easier so that you don't need to have 120 appointments. Therefore, you need someone who organizes a patient journey. So it's a team effort, really. We need to also keep an eye on international professional standards and make sure these are available also in Hungarian. And something else that's important is money, money, money. Funding is needed. Good devices or diagnostic or therapeutic options are no use if you can't afford them. Now, it's also important that you have a neuromuscular team. You need to fund all aspects. For example, when you go to consult an orthopedic professional, say for hours, such consultancy is not included in funding. Now, what's going on now? Back in 2012, as a joint effort from a number of players, resulted in the Budapest Neuromuscular Centre, which is practically a cooperation agreement involving all the relevant institutions and centers with the aim to hit the targets and objectives I have spoken about. Sadly, some of these institutions have discontinued their activities since then, but I think the core has remained. Who are the members of the multidisciplinary neuromuscular team at the moment? Okay, within Semmelweis University, we have various areas. At the pediatric clinics, we have several specialized areas. We could could involve to have the necessary specific and specialized knowledge. We also work in close cooperation with the Institute for Genomic Medicine and Rare Diseases. And within the university, luckily, we were lucky enough to find colleagues at the orthopedic clinic who are involved in patient care. The rehabilitation department of another Budapest hospital is also involved, and we have cooperation agreements with surgery centers elsewhere in the country. And let me underline once again, it's not enough to have the professionals available. You need to make sure that these people are dedicated and committed to people with neuromuscular conditions, that there is good cooperation between them. How can we get that? Obviously, there are events and trainings exactly for this purpose. But what we were trying to do was, since 2018, we had an SMA network, which was great help in finding out and introducing, putting in place new therapies as soon as possible, making it available. And ever since then, we have had events when we sat down together with a team, including nutritionists even, to sit down and discuss individual cases. Now, how does cooperation work towards parents, for example? It would be extremely important if we could have neuromuscular nurses who focus on, whose job is to actually organize and manage patient journey. Or case managers, neuromuscular case managers. And the feedback is that such colleagues are priceless and are great help, but we should have more of such people available. Now, let me say a few words about new therapies. They are very welcome. Everybody's looking forward to see them, both professionals and those affected. But what you need to see, that new therapy means new challenges for the team, because you need to learn about that medication. You need to use IV treatment more often, like every other week. And obviously that puts an additional strain on the system. And it's a burden on the healthcare system. And you also need to update your knowledge, because there are new phenotypes, there are people affected in another way, in a way different than we have seen before. So we need to keep learning all the time from each other and from those affected to make sure that we can offer the best available for those who have been newly diagnosed. People have a higher life expectancy, which is great, but then you need to have something to offer. You need to identify and change, adapt rehabilitation purposes, because if you have a stagnating condition, that's a different challenge than someone with a progressing or even improving condition. Great attention has been paid to this area, which is great because it raises awareness both in terms of society, and also, for example, insurance companies have a better understanding of the situation. And this attention we receive might result in increased funding, for example, involved organizations, for example, organizing conferences like this one. I have talked about cooperation and communication and the presence of professionals in the team. Okay, now let's look at professional standings. Now let's look at spinal muscular dystrophy, atrophy, SMA. because this has received the greatest focus and attention. We have an international standard since 2018, which covers most aspects. And using this as a cornerstone or as square one, I think we have done a great job in providing Hungarian national professional guidelines, which was updated last year. I think that's great. The latest version even includes therapy proposals. The consultant, Dr. Mikos, has put incredible work into this. Okay, what therapy is available for SMA? And now we are in the lucky position because both Nusneze and healthcare funding is available. There are early access programs, and we can receive funding. About 100 children have received medication to treat SMA, and 6 centers are able to receive such little patients affected. And you may not know, but as of November last year, newborn babies are screened for SMA, which is quite a novelty. And then in clinical trials, it's also available to receive higher doses of the medication. And there are many clinical trials in progress, still underway, new gene therapy preparations or other medication, myostatin inhibitors, etc. But I think we will hear about these later on today. Okay, let's see Duchenne's muscle dystrophy, DMD. It has it's covered internationally quite good. Sadly, Hungary is lagging behind. We have been working since May 2019, but still haven't managed to put it on the table. But let me tell you that at the moment we have 18 relevant guidelines, out of which one is SMA. So coming up with a professional guideline is tremendous work, immense work, definitely not easy. So it's work underway, but we're still not there. When it comes to DMD, funded on an equity basis is available. That's available. Teluram, for example, available for about 10% of those affected. As Madam Professor mentioned, there is a clinical trial going on, and also elsewhere in the world, clinical trials are ongoing. Most popular ones are focusing on substances, looking at the generation of dystrophin. When it comes to CMT, the situation is even more challenging. It is much rarer than DMD and SMA. We do not even have well worked out international standard, but there are guidelines very good guidelines on surgical procedures and also rehabilitation management, which is, I would even say, it's better in CMT than in other areas. Well, and again, when it comes to a Hungarian professional guideline or standard, it hasn't even come to the stage of a proposal yet, but let's hope we'll get there. Now, medication for CMT, it's not available with funding, not just in Hungary, but elsewhere either. There are lots of clinical trials, but if you look at them one by one, practically there is only one effective ingredient that seems promising, but that's involved in several trials. So what I'm trying to say is that there are several trials ongoing. Some have failed. Some are still in clinical phase. This is just to give you an idea how difficult this is. For example, there is a substance in phase 3 which is lagging on because it turned out that the active ingredient crystallizes if it's dissolved. And then we had to stop, get back to square one, because results we got were rendered by this fact invalid. So there are unexpected obstacles in clinical trials, and then you need to get back to square one and start again from the drawing board. What other tasks does a neuromuscular center has? Well, if you are a center, then you have a responsibility in making sure that the members of the team have updated knowledge. Those affected, their families, have access to updated knowledge, that they are able to actively participate in trials, etc. Now, actively participating in registers, having registers of SMA, DMD, etc. Raising awareness, as pointed out by Dr. Gross, is extremely important. So let me point again to the website ISOM-Info, muscle information, and I'm sure those involved will know this. It was a concerted effort by national and international professionals. It's very important to have the descriptions of the disease in Hungarian that's easy to understand, and also we should have information on events, on the latest information, and very important is that it should be available in Hungarian, and we are grateful for any help. We received information about a webinar about bone health, which will be published and advertised soon. And we are doing all this to make it available and help you, give you a helping hand. So if you have any proposals, ideas, you're welcome. Please share. Do not keep them to yourself. And thank you very much for listening to me.
Thank you very much for this comprehensive overview of neuromuscular patient treatment in Hungary. Let's see if there are any comments or questions. Yes, I would like to ask a question. I am affected by another disease, but my question is, when a woman has a child and comes up with the idea that the child might have a problem, how much time does it take typically to diagnose the disease? Well, that depends very much on what the actual diagnosis is. In the case of SMA, we surveyed this just because there are now new therapies, so we went back to previous cases, and typically when we started talking about this situation a lot, then the diagnosis, the time it took to come up with the diagnosis became much shorter, typically. Sometimes it's a month, sometimes it's actually several years. And it's also, depends on where the patient starts out his or her journey. If they go to Neuromuscular Research Institute for the first test, that will be quicker than if they just go to the general practitioner. Thank you very much, says the moderator.